All right, so you want to talk about AI completely changing healthcare. We're going deep, deep into all these reports, guidelines, all this research to bring you the stuff you need to know on how AI is changing medicine.
It's a fast-moving world out there. What we're trying to do today is break down not just what this new tech is, but give you what you need to know to understand the standards, the frameworks, the good it can do, and help you navigate all this.
But here's where it gets really interesting. We're not just saying, let's throw AI into hospitals and hope it all works out right. It's a whole process, almost like a life cycle. Like building a house, you wouldn't just put the roof on without a good foundation first.
Right. Perfect analogy. And these reports, especially from groups like CHAI, really emphasize this idea of assurance checkpoints all throughout. Think of them as these quality checks at every stage of building that house, making sure that AI is safe, that it works, and that it's fair every step of the way.
So before a hospital even thinks about using, say, a new AI diagnosis tool, they can look at these checkpoints and ask, okay, did the people who made this do it responsibly? Did they think about what could go wrong? And do they even have a plan to watch out for problems once it's being used on real people?
Precisely. And it's more than just checking boxes. These checkpoints, they really dig into the details, like how exceptions are handled. So, for example, what if a patient doesn't fit the data that the AI was trained on? Maybe their background wasn't really represented. Well, there needs to be a clear way to flag those cases and deal with them.
It's like a backup plan, a safety net, right? To make sure someone doesn't fall through the cracks just because the AI can't handle their unique situation.
That's it exactly.
Yeah.
And that takes us nicely to our next big idea, trustworthy AI. Because just existing isn't good enough. These systems, they need to earn our trust, don't they?
Trustworthy AI. I'll be honest, sometimes it does sound a bit like one of those buzzwords you hear all the time, like synergy or, paradigm shift. But we're talking about real principles, things that are being built into guidelines and standards, right?
Absolutely. And these aren't just nice-sounding words. They're practical things to think about that can completely determine whether or not an AI system works in a healthcare setting.
So when we say trustworthy AI, what are those core principles, the things that really matter?
One of the most important ones, and it comes up again and again, is transparency. We have to know how these systems work. What data are they using? How do they even make decisions? And not in some technical language only a programmer could get, but in a way doctors, patients, even regulators can grasp.
Think of it this way. It's one thing to be told, the AI says you need surgery. It's a whole different thing to understand why. Transparency, that helps us make good choices about our own health.
Right. And hand in hand with transparency, we need explainability. And that goes beyond just seeing the data, the algorithms. It's about understanding the AI's reasoning. Imagine being able to see how the AI thinks, following the logic that led to that decision.
But is there a risk, though, that by trying to make these systems transparent, explainable, that we dumb them down too much? I mean, some of these AI models, they're incredibly complicated.
That is the balancing act, though, isn't it? That's what developers are dealing with all the time. How do you make something understandable without losing the complexity that actually makes it effective? A constant challenge, that's for sure.
And while we're talking about complexity, what about fairness? Because it's not enough for these systems to be right, they also have to be fair and equal for everyone.
You're absolutely right. We're talking about healthcare, where decisions can literally be life or death. That's why groups like CHI and NIST, they're saying we need to address potential bias from the very beginning, from the data used to train the AI to how it's watched in the real world. It's like building those safety checks into that house, right?
Right.
But for algorithms.
So how do you actually do that? How do you make sure an AI, let's say it's designed to tell if you might be at risk for heart disease, how do you make sure it's not accidentally biased against certain groups of people?
It all starts with the data, right? It needs to represent the people it's going to be used on. And that doesn't just mean a lot of data, but the right kind of data. Data that reflects how diverse people are.
Because an AI that's only trained on data from men, for example, isn't going to be very good at diagnosing conditions that mainly affect women, is it?
Exactly. And that's where things like data protection impact assessments come in.
Hmm.
It's about taking a hard look at where the data came from, how it was collected, and if there are any built-in biases that need to be addressed.
So it's not just about having a ton of data. It's about having the right kind. It's about making sure the foundation of that house is strong and level.
You got it. And it's not just the data either. It's the algorithms themselves. Even with perfect data, a badly designed algorithm can still lead to big problems.
Right, because even a house with a solid foundation can still have cracks if the walls are built wrong. So how do we make sure the algorithms themselves aren't causing bias?
Think of it like constant maintenance, right? Developers have to test that AI on different sets of data, looking for any patterns of discrimination, and then they have to adjust it. And it's not a one-time thing. It's constant monitoring, tweaking, even after the system's up and running.
So, trustworthy AI, it's not just a fancy phrase. It's about building systems that work well and ethically. Systems we can actually trust with our health.
Precisely. It's like making sure that house isn't just structurally sound, but it's also a safe, welcoming place for everyone who comes in.
Okay, so we've covered this idea of the AI lifecycle with these assurance checkpoints and those core principles of trustworthy AI. But where does regulation come into all this? Because, let's face it, technology often moves way faster than the laws trying to control it.
You're not wrong. And that's why this next part is important. We're going to dig into the world of AI regulation, and it's always changing.
Buckle up, everybody, because this is where things get really interesting and maybe a little complicated. But don't worry, we'll be your guides through all these rules and regulations. We'll highlight the most important initiatives around the world from the US to the EU and beyond.
And what's fascinating is there's no single answer, no one way to regulate AI. Different countries, different regions, they're all taking different approaches, which could have a huge impact on how AI and healthcare actually unfolds in the years to come.
It's like a big global patchwork quilt of regulations. Each patch is a different way of trying to govern this powerful technology.
And figuring out that patchwork, it's essential for anyone involved in making or using AI in healthcare. These regulations, they're not just suggestions, they have consequences. They can say what you can and can't do with AI, how you collect data, use it, even where you can use these systems.
So where do we even start trying to understand all of this?
Let's start with the US, since that's where most of our listeners are. One of the biggest things happening here is something called the ONC's Algorithm Transparency Certification.
Algorithm transparency. Okay, I mean, it sounds pretty much like what it is, but I have a feeling there's more to it, isn't there?
You're right. It's all about bringing some much-needed light into the world of healthcare algorithms, which can often be a bit murky.
So no more black boxes.
We're hoping not. This certification, it pushes developers to be much more upfront about how their AI works, what data it's using, how they're handling potential risks. It's about giving users, whether that's hospitals, doctors, maybe even patients themselves someday, more insight into how decisions are being made.
Sounds like a step in the right direction. But how does this actually work in practice? Do developers just get a gold star for being transparent, or is there more to it?
Think of it less like a gold star, more like a really thorough inspection. To get this certification, developers have to give detailed records of their algorithms, go through audits, and they have to commit to constant monitoring and risk management. It's about proving they care about transparency long term.
So it's not just a one-time thing, it's an ongoing commitment.
Exactly.
Mm-hmm.
And that's important because it gives everyone more confidence in the AI being used to make decisions about their health.
That makes sense. So that's the US being proactive. What about across the pond? What are our friends in the EU up to with AI regulation?
They're actually taking quite a different route. The US, they're all about transparency, accountability. The EU is a bit more cautious with something called the AI Act, which focuses on risk.
The AI Act sounds serious. Tell me more.
It's a major law that aims to control AI systems based on how risky they are seen to be. They've actually identified some AI applications as high risk, and those will have much stricter rules. We're talking mandatory human oversight, tough data quality standards, and in some cases, they might even ban some uses completely.
Whoa, bans. What kind of AI are we talking about here?
Things where the risk to basic rights is just too high. For example, the AI Act puts big limits on using real-time facial recognition in public.
Yeah, facial recognition definitely comes with a whole other set of ethical issues. But how does this whole risk-based approach work in practice? Who decides what's high risk?
That's a great question, and honestly, it's still being debated. The AI Act gives some broad categories, but there's a lot of gray area. In the end, each country in the EU will interpret and enforce the law in its own way, which could lead to some interesting differences in how AI is regulated across the EU.
So even within the EU, there's a bit of a regulatory patchwork quilt going on. Sounds like lawyers are going to be busy. But what does it all mean for the future of AI in healthcare?
It's hard to say for sure, but it'll probably have a big impact. AI developers are going to have to think much more carefully about the risks of what they're building and build in those safeguards from the very start.
Nobody wants to be on the wrong side of the AI Act.
Exactly. This could lead to a much bigger focus on explainability, on humans being involved in overseeing things, as developers try to make sure their AI isn't seen as too risky.
Okay, so we've got the US all about transparency, the EU being more cautious with their risk-based approach. Where does the UK fit into all of this?
The UK is interesting because they want to be seen as leaders in AI innovation, but they also want to address the ethical and social implications. They're going with what they call a pro-innovation way of regulating AI.
Pro-innovation. Hmm. Sounds promising, but also kind of vague. What does that actually look like in the real world?
Basically, it means they're choosing to be flexible, to adapt, rather than having really strict rules. Instead of creating a whole new system for AI, they're encouraging the regulators they already have to create sector-specific guidance on using ethical principles for AI.
So instead of one size fits all, each area gets to figure out what works best for them.
Right. They're putting a lot of faith in self-regulation in industry best practices, with the idea being to help innovation while still being aware of the risks.
Okay, but that kind of sounds like the Wild West of AI regulation. How do they make sure companies actually follow the rules if the rules aren't as clear?
That is the million-dollar question. They're really relying on collaboration, on everyone talking to each other, regulators, industry leaders, other stakeholders. They also want to introduce a legal requirement for regulators to consider AI-specific risks, along with the principles they've laid out. But really, we have to wait and see if this hands-off regulation works or if they'll need stricter measures.
Interesting. It's a bit of a gamble, but one they're hoping makes the UK the place for AI.
Absolutely. And it'll be interesting to see how this all plays out long term. But for now, let's maybe shift gears a little. We've talked a lot about the big picture of AI regulation, but what about how it's actually used?
Yeah, let's get down to the nitty-gritty and look at some real examples, because at the end of the day, this is all about how AI can be used to actually improve people's lives, right?
Exactly. And in our next section, that's just what we'll do. We'll look at some real-world use cases, from the complexities of NGS bioinformatics pipelines to the challenges of automating all those clinical documents we all dread.
Stay tuned, everybody, because things are about to get real.
All right, let's get into it. Let's see how AI is actually being put to work in healthcare.
I'm ready. Where do we start?
One place AI is really making a splash is in genomics, specifically something called next-generation sequencing, or NGS bioinformatics pipelines.
Next generation sequencing. Okay, that sounds impressive and all, but in plain English, what are we talking about here?
Imagine being able to analyze your DNA, your RNA, faster and cheaper than ever before. That's what NGS does. It gives us huge amounts of genetic data.
Okay, so we've got mountains of genetic information. What does AI actually do with all that?
Analyzing that much data, it's like trying to find a needle in a haystack, except the haystack is gigantic, and the needle, that's the key to understanding your health. NGS bioinformatics pipelines, think of them as AI-powered sieves, helping us go through all that data and find what's important.
So it's like having an AI assistant that can spot the genetic red flags that might make someone more likely to get certain diseases. Talk about personalized medicine.
Exactly. We're talking about finding potential risks before you even have symptoms, which means we can intervene earlier and hopefully get better outcomes.
That's amazing. But something this powerful, there have to be challenges, right?
Of course. One of the big ones is making sure those AI algorithms are accurate and reliable. We're talking about people's genetic blueprints, so even small mistakes can have big consequences.
And I bet data privacy security, that's got to be an even bigger concern when you're dealing with something as sensitive as genetic information.
Absolutely. Those are things researchers and developers are working on constantly. But the potential benefits, they're huge. Imagine a future where treatments are tailored to your unique genetic makeup, so fewer side effects, better results.
It sounds like something out of science fiction, but it's becoming real. What other parts of healthcare are getting this AI treatment?
Well, let's go into clinical settings, where doctors and patients actually meet. One area AI is showing a lot of promise is in analyzing medical images, like X-rays and CT scans.
Like having an AI colleague with superhuman pattern recognition, helping doctors see things they might miss otherwise.
Exactly. This could be a total game changer when it comes to getting diagnoses right and getting them faster, which is super important in emergencies and time-sensitive situations.
Okay, so AI is lending a helping hand or maybe a helping algorithm in the diagnostic department. What about the admin side of things? All that paperwork that doctors are always buried in. Can AI help with that?
That's the million-dollar question, right? There's a lot of potential for AI to automate clinical documentation, things like taking information from patient records and making reports, summaries, even billing codes.
Now, that would be amazing for doctors. They could finally get rid of some of that paperwork.
Right. But it's not as easy as it sounds. One of the biggest challenges is just how complex medical language is and how much it varies. Doctors' notes, they're famous for being hard to understand, even for other doctors.
It's true. I've seen my fair share of doctors' handwriting, and let's just say it's not always the easiest thing to read.
Exactly. To get AI to understand and pull information from those notes, you need really advanced natural language processing. We're talking about things like subtle meaning, context, things that AI is still learning.
So, automating all that documentation, that might be a while off. But what about stuff that's happening sooner? What can we expect to see in the near future?
One area where AI is already making a difference is in coding and billing. There are algorithms that look at patient records and figure out the right billing codes, which makes the whole process smoother and reduces errors.
Okay, so less time trying to understand medical jargon and fix billing mistakes. That's a win for doctors and patients.
Exactly. It lets healthcare professionals spend more time on what matters, taking care of patients.
Speaking of which, how is all of this actually affecting the patient experience?
Think about it. Have you ever just wanted to ask a quick question or book an appointment without having to go through a phone system and wait on hold forever?
Who hasn't?
Well, now there are AI-powered chatbots that can do that. They give patients basic info about their health, medications, even help them schedule appointments.
It's like having a 247 assistant for all your healthcare needs.
Precisely. And this could be really helpful for people who have trouble dealing with the healthcare system, maybe because of language barriers, disabilities, or even just not knowing how things work.
So, it's about making healthcare easier to use and less scary for everyone. But with all these advancements, how do we make sure those ethical things we talked about before aren't forgotten?
That's the big question, isn't it? And it's something we can't forget about as we do all this. It's not enough to just make new AI tools. We have to make sure they're used responsibly and ethically.
Because in the end, AI should be about giving patients and healthcare providers more power, not creating new problems.
Exactly. It's about finding that balance between cutting-edge technology and caring for people. And that means we need to keep focusing on transparency, accountability, and using AI to make healthcare better.
So it's not just about what AI can do, but how we use it. And that how seems to be a big theme in all of this. How we develop these systems, how we regulate them, and how we actually put them to work. All of that will decide how AI shapes the future of healthcare.
You're absolutely right. And as AI gets even more advanced, we'll have even bigger questions to answer, more challenges to overcome.
Like what happens when the AI disagrees with the doctor?
Exactly. It might sound like a sci-fi movie, but it's a real question we need to start thinking about now.
Doctor versus machine. Okay, I definitely want to get into that.
Well then, get ready, because we're going to explore that very dilemma in our next segment.
All right, so we're back, and I gotta admit, this whole doctor versus machine thing, it really makes me think of some big showdown, like straight out of a sci-fi movie.
Well, let's hope it doesn't get to that, but it's definitely a question we need to think about, Yeah. What does happen when an AI says one thing, but the doctor's gut feeling says something else?
Right, because you've got years of medical training and experience on one side, but then you've got the AI, which has looked at tons of data and can see patterns humans might completely miss. It's a tough one.
It really is. And there's no simple answer, no one solution that fits every situation. Sometimes what the AI recommends might be clearly better. Maybe it picks up on a rare condition the doctor hasn't seen before. But other times, it's not so clear-cut. That's where doctors' experience, that gut feeling, can be super valuable, especially with really complex cases where there's a lot going on.
So it's not about AI replacing doctors completely, but more about finding ways for them to work together, each one playing to their strengths.
Exactly. And that means everyone needs to change how they think about this, doctors and patients. Doctors need to be open to AI as a tool, a powerful tool, but not something that's going to take their job. And patients, they need to understand that sometimes the AI might pick up on something that their doctor doesn't necessarily see as a problem right away.
Which is where that transparency we've been talking about becomes even more important.
100%. We keep coming back to transparency, and for good reason. In this case, it's about being really honest with patients about how AI is being used in their care. If a doctor disagrees with what the AI says, they need to be able to explain why, clearly and honestly.
It's all about trust in the end, right? Patients need to be able to trust their doctors, trust the healthcare system, and yeah, trust the technology that's being used to make these big decisions about their health.
You got it. And building that trust It starts with education.
Mhm.
Patients need to get what AI is, how it works, what it's good at, and what it can't do. It's about giving patients the knowledge to be involved in their own healthcare, even when AI is part of the picture.
They say knowledge is power, and it sounds like both patients and doctors are going to need a crash course in AI as it becomes more common in healthcare.
For sure. Doctors need to know how to make sense of those AI recommendations, when to trust them, and when to go with their own judgment. It's about working with the AI, not against it.
A partnership, then, working together for better healthcare for everyone. That's a great way to think about it. And I think that's a great place to wrap things up. We've gone over so much today. We talked about that whole life cycle of AI, those super important principles of trustworthy AI, how different countries are creating rules around it, and the challenges of bringing AI into the doctor's office. Phew, it's a lot to take in.
It definitely is. But I think the main point here is that the future of AI in healthcare, it's not decided yet. It's being shaped right now. And we all have a part to play in deciding what that future looks like.
So true. And with that, I want to say thank you to you, our listeners, for coming along on this journey with us into the world of AI and healthcare. We hope this deep dive has given you the knowledge, the insights, whatever you need to navigate this exciting, complex, and ever-changing landscape. Until next time, everyone, keep those brains buzzing.